Okay, well, generally when we meet a patient for the first time, what I like to do is I like to see what their individual needs are. I like to offer them the individualized care treatment that would optimize their situation and offer them options that would help them through their journey to succeed. For one, I try to be as reassuring and supporting and encouraging as I can. I'd like to be as gentle as I can when I speak with them. I'd like to explain things to them so they are more familiar with things rather than have things be unknown. In my experience, when people are in the unknown territory, they're more apprehensive, more anxious, so I want them to be comfortable. And then once I can hopefully get to that stage, I find it a lot easier to go forward. We see many different types of patients with many different situations. We see women who are young or old with tubal disease. We see patients with male factor problems where the male may not have any sperm or very little sperm. We see patients that don't ovulate regularly. We see patients that have what we call low ovarian reserve, where they don't respond well to our fertility drugs that are meant to help them succeed. We see a lot of different types of patients. And we also see a combination of those patients. We also see patients, same-sex gender couples, and it's very interesting with what we see. We see patients that sometimes require surgery because they have anatomical problems like a uterine malformation, things like that. The patients I see, I try to make them a very important part of the team because, again, we're here to help them. It's their dream, and everyone has their own dreams, and we're here to individualize what we offer them. So I need to understand them. They need to understand what we're looking at so they can direct us with how they want to go forward.